Hello everybody and welcome back to the Breakfast Club. You're with me, Ben Ibrahim, and if you're just joining us for the very first time this morning, we're with Dr.Nor on our Healthy Living segment, our weekly Healthy Living segment, and we're talking about how to have a positive baby delivery using the Ceaserian technique. So Dr.Nor, you shared a lot of common stereotypes before the commercial break. Now we're going to ask you for your tips. If someone does choose the Ceaserian technique, what kind of factors do they have to consider, and what's the best practice that they have to go through? So 2 questions basically.
Well, the first one is what sort of tips that they have to
factors
to consider.
Yeah.
First of all, the doctor that you need that's going to manage you, the healthcare provider, and also the hospital that you're going to have this baby. And preferably, of course, if you're going for a cesarean section, it has to be what we call a tertiary hospital, not a maternity home. Okay, not to have any issues with maternity home, because this is actually, whatever it is a major surgery.
It is a major surgery.
It is a major surgery, and you have to look into the possibilities of mother or baby and the things that could go wrong. You see, this is where a tertiary hospital, that means they have got a good support system in terms of an ICU, whether for the mother or for the baby, good theatres, a blood bank, and these issues have, I mean, you have to make that decision whether it's near your home, and also the financial budget, whether it suits your budget as well. Okay, then the other thing, your
financial constraints. Yes,
financial constraints. All this have to be discussed. I mean, there's no
that's good. That's a very good point that Dr. Nora mentioned. Financial constraints, financial resources.
Yes, see, because either way, also, if complications arises, what's going to happen? Do you have the resources as well? I'm just being too cautious here, lady, but nevertheless, you see, we have to be prepared.
Of course.
Okay?
Yeah.
But generally, it's very, very safe cesarean section. And we talk about mortality, death from anesthesia. It's like perhaps 1 in 7,000. Whereas if you were to go up in an aeroplane, you have a higher chances of actually dying from a plane crash. So having said that, also, you must have your regular antenatal checkup to make sure that your hemoglobin level, your iron levels are there, that you have good nutrition, in terms of whatever underlying medical issues, whether they have diabetes, hypertension, all that has been ironed out. And should you opt for an elective cesarean section as well, certain things you have to be prepared. You see, since you're going to stay longer in hospital, so what are the things?
The recovery time,
so you're going to stay longer, you have to bring a few more clothing. All right. But I also do recommend to bring your special lip gloss. Okay, so
vanity never goes far.
Yes, I want you to be positive. So when you, because again, when you are going for a cesarean section, you can opt whether you want to have an epidural anesthesia or a general anesthesia. And I would recommend, in most circumstances, an epidural anesthesia, because then you're actually participating with the childbirth, during the childbirth. So we can hear the baby when we deliver the baby cries, and you can cuddle the baby, you can even suckle the baby immediately after birth itself. See, so these are the excitement that the husband will be there, you'll be there, and you participate, and actually you do recover faster. And having said that, in hospital, sure, in the first 24 hours, you might be a bit confined to the bed, but after that, then we do encourage you to try to walk up, to mobilize. Maybe you're a bit dizzy, but get some help. You can actually start having some nourishing fluids, and make sure also post-delivery, your diet is also top priority. No pantang, restrict water, restrict this vegetable, restrict that. No, you should have lots of fruits, vegetables, fibers, adequate hydration. These are important. And again, when, let's say, before discharge, check with your doctors again. I mean, discuss with your doctors. What are the possible things, or what are the things I have to look out for, that I should be careful, that I have to come back, and the things that you are concerned about if you go home post after being discharged from the hospital. I mean, are you having some fever that's
the symptoms
very high
afterwards,
fever? Are you having excessive bleeding post-delivery, I mean, after discharge? Are you having some pus that's coming out from there? Are you suddenly developing rashes all over your body? These are some issues that perhaps might need emergency attention, that needs you to come back. Or you're having some pain in your legs, which might suggest deep vein thrombosis. So
deep vein thrombosis is still, it's part of the equation,
very rare, darling. It's very, very rare.
Very rare,
Yes, okay. But still, it does happen. Well, I would say to those who are fat, obese patients.
Weight issues,
weight issues, you see. So again, like I said, we have women from all shapes and sizes and ages as well. So these are the areas that you should know, I mean, be careful about. And what are the things that you need to do at home, okay? Have a good support environment, because after delivery, you don't want to be carrying anything heavier than your baby. In
True.
other words, no heavy duty. No heavy duty.
Can cause injury as well.
Yes, you see, because your muscles are still weak, so we don't,
fragile.
And fragile. So we take time to heal. So you don't want to do any heavy duty things.
No, you don't.
Yeah. So literally.
No running marathons, mums. Yeah.
Not yet. But maybe about 3 months after that.
Yeah.
So don't use tampons. No sex yet. No sex yet. Okay, till perhaps maybe after about, I would say, about 6 weeks. Then again, after that has all occurred, I said, okay, when do I plan for pregnancy? How do I plan to make pregnancy? These are the things that, of course, you still have to go back to your doctor to, for the postnatal check. Because I do have some patients, unfortunately, feel that they're so great, they're so well, and they don't come back after postnatal.
Yeah,
but
true.
these are rare. But nevertheless, don't take it.
So don't disrespect it. Just because you're feeling well, then say, oh, okay, you know, I'll see.
Fine. I'll see when I go
fine, you know, until my next checkup, whatever.
Yeah.
Okay. Okay. Now, Dr. Nora, sometimes you have patients who panic, like if they're just feeling the slightest headache, like the slightest muscle sore, and they think, oh, I've got to go see the doctor. I've got to go see the doctor. I mean, there are some patients out there like that. So, when a person is going through the healing process, what should they look out for, like abnormalities, or just, you know, expect? What kind of normalities can they expect?
Well, even after discharge from the hospital, you will feel some aches and pain. The soreness will be there. So that is normal, yeah? Yes, but it will slowly go away by, it get less and less by about a week or so, you know. So you actually feel less and less pain. But if you still have persistent pain or persistent headache, then there is something that.
When you say persistent over a couple of days?
I'm thinking of the possibility of sometimes a woman going through epidural, not unusually, sometimes, not uncommonly, I say, might have what we call a spinal headache from epidural. So in that case, even taking 2 Panadols, it won't go away, taking fluids won't go away. So this is where they have to go. But if they just have a headache, then I would say, drink more fluids. You know,
fluids. Water is the key.
Yeah, and breathe well. You know, perhaps you have to open your windows, get more ventilation in. These are some areas that you have to do, and try and relax and catch up some sleep. Maybe get someone to look after the baby so that you can catch up some sleep. Because all this fatigue, dehydration can cause all these headaches as well.
Good point, good point. And it's all about planning, like Dr. Nor said. Dr. Nor, unfortunately, we're just slightly running out of time. We could go on about this. This is such an interesting topic. And this interview was designed mainly for first-time mums to be in the year 2011. So, folks, we hope you've got some very good tips here from Dr. Nora. But before we go, Dr. Nora, can you please tell us a website of your company, or where people can find you on the web? So, you know, if they want more information or how to contact you, all the above?
Yes, you can read about Primanora from www.primanora.com, Primanora.com. And of course, if you go to that website on my resources, you can even look at some of the articles I've written in the star columns. And sure, if you have any infos, you can always just write in and just, well, I'll try to answer them.
Okay, folks, Dr. Nora, gynecologist, founder of Primanora Medical Center, and most of all, a mother and a positive person. On behalf of Dr. Nora and myself, Ben Ibrahim, have a great Wednesday. We'll see you tomorrow morning right here on Bernama TV, The Breakfast Club. We'll see you soon. Have a great day.
Bye. Thank you, Ben.
It was fun.